Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
For hydronephrosis, sometimes for hydronephrosis, this is one question relating one question. For hydronephrosis, DJ stunting and peripheral nephrostomy. Even if you do DJ stunting or peripheral nephrostomy, both will show same results. But what is less invasive? DJ stunting is less invasive. Whereas for pyonephrosis, it is better to do percutaneous nephrostomy is better than DJ stunting. So for pyonephrosis or for hydronephrosis, one important thing is percutaneous nephrostomy is definitely better than DJ stenting. For pyonephrosis, percutaneous nephrostomy is better than DJ stenting. But for hydronephrosis, DJ stenting is better than percutaneous nephrostomy because DJ stenting is less invasive. So DJ stenting is better than percutaneous nephrostomy for hydronephrosis, whereas for pyonephrosis, percutaneous nephrostomy is better than DJ stenting.
thank you and thank you for watching.